Dr. Gabor Mate. Today we will going to discuss about pioneer, one of a kind pioneer of our times, Dr. Gabor Mate. He is an Hungarian-born Canadian Jewish origin physician. His expertise lies in addiction, trauma, anxiety. He is basically a physician who worked with thousands of patients sufferer of addiction, trauma, anxiety, depression, especially with the prisoners. He had tremendous experience and he now has his own theory which is quite enlightening, and I would recommend everyone to watch his TEDx video about addiction. It is fascinating and it is unique, out of the box thinking. Today I am going to highlight a few quotes of his. It is impossible to understand addiction without asking what relief the addict finds or hopes to find in the drug or the addictive behavior. How true. Autonomy is impossible as long as one is driven by anything. While nervous tension may be a component of stress, one can be stressed without feeling tension. So true. In the real world, there is no nature versus nurture argument, only an infinitely complex and moment by moment interaction between genetic and environmental effects. Of course, it goes with the theory gene environment interaction. Some of the biological science students will understand what I want to convey. A long-term substance abuser, a few months before his death, penned his poem. In downtown Hastings and Maine looking for relief from the pain, all I did was find a ticket on a one-way train. Give me peace before I die. The track is laid out so well. We all live our private hill, just more tickets on the hellbound train. How traumatizing and fascinating at the same time. It is impossible to understand addiction without asking what relief the addict finds or hopes to find in the drug or their addictive behavior. So true. Medical thinking usually sees stress as highly disturbing but isolated events, such as, for example, sudden unemployment, a marriage breakup, or the death of a loved one. These major events are potent sources of stress for many, but there are chronic daily stresses in people's lives that are more insidious and more harmful in their long-term biological consequences. Internally generated stresses like that take their tolls without in any way seeming out of the ordinary. The difference between passion and addiction is that between a divine spark and a flame that incinerates. How true. Not why the addiction, but why the pain. Attack the cause, not the symptoms. The very same brain centers that interpret and feel physical pain also become activated during experiences of emotional rejection. In brain scans, they light up in response to social ostracism just as they would when triggered by physically harmful stimuli. When people speak of feeling hurt or of having emotional pain, they are not being abstract or poetic but scientifically quite precise. A heart is at the center of all addictive behaviors. The wound may not be as deep and the ache not as excruciating, and it may even be entirely hidden, but it's here. As well, see the effects of early stress or adverse experiences directly shape both the psychology and the neurobiology of addiction in the brain. So true, and at the same time enlightening. Please do like and subscribe. Thank you.